Hey. Good? Yeah. So many bags to carry, man. Yeah. Oh, I'm talking about myself everywhere. Okay. Hey.
Thanks for waiting. I'm longer than expected.
Yeah, I know. I was sitting there playing my phone, man.
Stephen, do you know the reason it took so long?
Yeah.
Was because I can't make my mind up and I'm not sure about whether or not you need to be on a compulsion order or you do.
Okay.
The one of the things that you don't, and we're trying about this, is actually you understand that you've got schizophrenia.
Yeah.
You understand if you don't take medication you'll become psychotic.
Yeah.
It's happened to you in the past.
It has.
You want to take your medication.
Yeah.
And you're not having any thoughts about hurting yourself or anyone else.
Yeah, of course not. No.
Can I just double check? Because I think I didn't actually, maybe I did, but I've forgotten. When's the last time you did hear a voice?
It would have been in the months prior to 2022. I wasn't so much hearing voices when I was in Turkey so much as it was paranoia. So.
Because I think last time you said you'd heard voices a few months ago, 5 months ago.
Yeah, that was when I was in Ukraine.
Okay.
To be honest with you, when I was in Ukraine, the situation became a little bit more difficult because I was switching medications all the time. But, and like in terms of it being a problem, it was just 2021 to 2022 when I was unmedicated. As in I wasn't aware of it. There was only in the periods after that I was aware of it and able to recognise it. You know what I mean?
So Stephen, part of me is thinking that actually we would just take you off the compulsion order.
I can't believe it.
But the thing that's stopping me from just actually going back before talking to you is I'm worried. I'm really worried. What do you think I'm worried about? Just to get your perspective.
I think you're worried about me becoming sick again, and certainly the things that you just mentioned, maybe, well, on the small scale of it, the things I said, and on the bigger scale of it, the things that you're mentioning as well. So,
I think the thing that I'm worried about, Stephen, is you are either worried or paranoid, I'm not sure, but you're worried or paranoid about us. Mm-hmm. You see us as kind of actors that are in cahoots with the police and new case and this and the next thing. You think that we're working against you, and my worry is that you, not under the compulsion order, would simply go and say, right, this is my chance, get all my ducks in a row, I'm off. And then I would feel, to be frankly, I would feel terrible if I had let somebody, and I know you're saying you're not going to do this, but if you did go to the airport and sought asylum somewhere, and then you couldn't get back, and it was because you were psychotic,
something were to happen or something.
I would just think, did I just let somebody ruin their life because they were unwell and I didn't realise it and I didn't treat it properly?
Yeah, I understand these things. I trust you guys wholeheartedly. I come here every time. I'm just quite a closed off individual when it comes to previous mental health situations. I don't like to talk about them, but I apologise if I come off as being untrusting.
You've been recording, that's what you're saying as well, so that's not
very when I started this recording, we acknowledged it, obviously not to share it, do you know what I mean?
Yeah, no, but even like other times as well, we have it said, which tells me that there's something you do you don't trust about me or you don't trust about us.
It's just for documentation. Given what happened when I was in Ukraine, we don't need to get into all that. Allegations, obviously, whether factual or not. But I like to record all my interactions. Obviously, when I'm off the compulsion order, it's something we no longer need to do. But if and when.
Yeah, I think so. Basically, Stephen, if we allow the compulsion order to lapse, so it would lapse on Saturday or Friday night.
Yeah.
You would then be a voluntary patient.
Okay.
We would still see you.
Mm-hmm.
I would still want to see you monthly.
Yeah.
I think it'd be good for Will to see you every fortnight.
Yep.
Face-to-face meetings.
Yeah, I was hoping we could maybe, well, to mention that street again, but maybe we could go down that way. Even Tesco's, it is what it is. If I get off the bus, it'll be okay, do you know what I mean?
It is tricky because you're just in an awkward place where there's not anywhere really nearby, but we can figure something out.
Yeah, man, that's sweet with me.
And I think, Stephen, from my perspective, what I want for you is just your mental health not to be a part of your life.
Yeah.
Actually, just carry on with your life.
Yeah.
but also I want you to be safe. And I think the issues that you had with the short-term back-to-back, I don't know what the legal stuff is with that and what rights of compensation you've got, blah, 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 blah.
Okay.
But I would agree, even an apology is appropriate for that.
Yeah, of course, of course.
I don't see why you can't seek that through services in the UK.
Yeah,
So I would disagree with you. I don't think you need to seek asylum for that.
yeah, okay.
And
I know
that
it's
seems
not.
extreme.
Yeah, I know it's not anyone's job, but I mean, if someone could help me out and link me to someone, that could help, then we can move on with it. You know what I mean? So
I think if that was resolved, would you want to leave the UK?
probably not. No, I mean, well, no. I've probably became quite a greedy soul when I've thought about amounts of money, kind of thing.
I mean, I think we'd all like that. Right?
Yeah, but that's what I mean. I'm sorry, I've forgotten the question. Tell me who pays off. Yeah.
Do you want to seek asylum in another country?
No, I don't.
Do you want to move to another country? So that's fine.
Well, what I mean is, if I had the money, it would be nice to have like a villa in Spain. You know what I mean, a timeshare or something. If you mean immediately and a damage to myself, then no, absolutely not. I've got a nice hostel. It sounds cliche, but you can see squirrels, foxes, doe, and all sorts of birds and wildlife and things. I've got a good place. I'm just hoping I can get a better place that's more secure. You know what I mean? So,
Right. I guess what I'm thinking then is, I'm not sure about this decision actually,
yeah.
but I'm thinking do we just let the compulsion order lapse? And so that way after Saturday you're just voluntary. That's what I'm thinking.
Yeah.
But I have to say Stephen, normally I'm pretty straightforward with these decisions. I actually feel a bit anxious about this decision.
I'm quite anxious as well. It's a big decision. It's between 6 and 12 months of your life that things don't change, but obviously you don't have the freedoms that you would have.
What freedoms are you hoping to get?
Just freedoms like being able to, presumably to be able to reschedule appointments. Obviously this one this week was a haste, but just simple things like because it's the New Year period, being able to go visit my family and things like that without being anchored to an order, you know what I mean? So to be able to do things again.
What I would say, Stephen, is obviously I've got most of my patients are voluntary that are in my clinic. If any of them start to show signs of psychosis, I'll say sometimes, not all the time, but sometimes have to detain them if we don't want to change the treatment.
Yeah, absolutely.
So we've got schizophrenia.
Mm-hmm.
You could become psychotic if you stop the medication, if the dose isn't enough. Sometimes as well people just don't respond to antipsychotics even if they have in the past.
Okay.
If that happened, I'd be thinking about having to look at changing your dose,
Yeah.
changing your medication.
Yeah.
If I was really worried about you, I'd be thinking about, well, do we need to think about mental health acts again? Do we need to think about hospital?
Yeah, of course. It goes without saying, if someone's a danger for himself or others, that's pretty much how it goes. So it's up to you.
So basically, it's the important thing is just that's not what I want to do. My aim is not to detain people.
Yeah.
I'm a community psychiatrist. My aim is to keep people in the community.
Yeah.
And voluntary is easier for everybody. So that's my aim. But I also need to be completely honest and say if I get worried, I'm going to get worried. And I think
Yeah, of course.
in your case, Stephen, I think if you did not come to appointments, if you did kind of not meet up for will or constantly cancel stuff,
Yeah.
I would start to think, oh, actually, how well is this guy engaging in treatment?
Yeah, absolutely. I'd have to agree.
The other thing is, please, so appointments with me once a month, at least for the next year,
Yeah.
just to make sure that things are alright. And it's just simply, how are you, how are things, how's your mental state, how's the medication, blah, 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 blah. Appointments with Will are the exact same.
Yeah.
Stephen, I can't express this enough, please be honest.
Yeah.
Because it's, even if you start to get unwell, if voices come back, if you start to get quite paranoid about stuff, it is still my aim to treat you without you going to hospital.
Yeah, of course. I agree.
So if you, and the earlier, this is clear evidence for all psychotic presentations, the earlier you treat it, the easier it is to treat it.
Yeah.
The longer you leave it, the harder it is to treat it, and the more likely somebody needs to go to hospital.
Yeah.
So if you're hearing voices and you come back, just tell us, and our first response will be, right, let's stop the voices so he doesn't have to go to hospital.
Yeah.
Let's stop the voices with the medication so we don't need to worry about anything and he can just carry on with his life.
Yeah, absolutely. That's something I would do anyway. I noticed that when I'm on medications, I'm aware of when I get psychotic. So
if you do, just tell us, because our first thought is not get them to hospital. Our first thought is
to help.
help them, treat them.
Mm-hmm.
Is to say, right, look at the medication they're on. Do they need an increased dose? Do they need to change to something else? Do they need a short course of diazepam or something, whatever it is?
Okay.
But please be honest, because I think the thing I'm most worried about, Stephen, today, and just I'm being completely honest, is that I'm worried I've made the wrong decision, and you're a bit unwell, but not really unwell.
Yeah.
But you're a bit unwell, and that's going to drive you to try and jump on a plane and seek asylum somewhere. And then if you're in a foreign country, we can't help you.
Yeah, I know.
You're stuck.
Yeah, absolutely.
And people with psychosis, if they're really unwell, you know, they can stop eating and drinking properly, they can self-neglect, they can end up homeless, they can end up at risk, you know, high risk people with untreated psychosis, really high risk of vulnerability to other people because the mind isn't working properly, so people can take advantage of them.
Yeah.
So if that happened and you're in a foreign country, there's nothing we can do.
Yeah, I'm aware.
So I think the thing I'm most anxious about is that I would hate for that to happen.
Yeah, I think everyone involved would. It's not something that I want to see happen either. So.
Yeah. Does that make sense?
Yeah, I understand everything. Yeah.
Even just about your accommodation as well, it sounds like you've got a really good thing there.
Yeah.
I know because I used to work at Access Point for a long time.
It's beautiful.
So I mean, I know homeless accommodation is people. I mean, when I was working there, you would always get them at a B&B, but now it's like getting turned away all the time, which are huge number of just not getting accommodations. If you've got a good deal there, you need to be really just always check with your housing officer if you want to go away for a couple of days, because sometimes it used to be that you could look out for even a night sometimes.
Yeah, that's true.
So be really careful if you want to go up north or go anywhere. Make sure they know in advance when you're going, when you're coming back, because they might not be able to keep your room, or they'll say you can get it for 24 hours or 48 hours. But please don't just think it where they are, or you'll get something else. Because I'm not trying to be negative, but I know the reality is that you potentially might be back out in the street again because there's no homeless accommodation just now. It's really please.
Yeah, I'm aware. I like the accommodation anyway. So
yeah, I mean, it sounds like you've got a good deal. So just
Even if you're going away to see family, just definitely let your housing officer know that.
Okay.
So that way they can keep your accommodation for you.
Yeah, that's the one. That's the one.
Because you're allowed to go see your family, obviously, but we don't want you to lose your house over it.
Yeah.
They're quite limited though. I think they used to be anyway. They're quite limited in how long they'll keep a room for. But as long as you're speaking in advance, you've kind of got the.
Yeah, they said. I think they said 48 hours when I moved in. So.
Just check it out with them just in case, because you want to make sure you keep hold of that.
Grand. So how do you feel?
I feel good, man. It's another assessment done. Do you know what I mean? So yeah, that's great.
So it's built on trust.
Yeah.
So it's built on trust, and actually, I've been really clear about what my worry is. Hopefully, that's not to scare you. It's just I'm sharing what's going through my mind.
Yeah.
So what's going through my mind is, worst case scenario is I've got this wrong. I should have extended it, and I haven't, and that means, you know, your paranoia can end up with you sitting in Russia. I know you said you're not going to, but I'm still worried.
Yeah.
A little bit at the back of my head. I'm like, I don't want this guy to be stuck in Russia, unwell, and there's no way we can help him. And then he gets there and he realises, I don't want to do this.
Yeah, it could be a mistake. It could be a mistake. So I understand.
Whereas, you know, there's nothing. If people want to go live in Russia, they can go live in Russia. But if it's because you're ill, you want to do it, I would feel terrible.
Yeah.
So the most important thing going forward is work with us. Yep, it's going to be annoying having the appointments once a month for me. You know, it's going to be annoying having to see, well, if it's not that annoying, if it's not that annoying. But it's just because, Stephen, we just want to make sure you're alright.
Yeah.
Sure you're fine. And if you're not, just tell us. Our job is not get you into hospital.
Yeah, just let you know, if any early warnings and things like that, let you know as soon as possible.
And then it's how do we fix it before we have to think about hospital. We don't want to think about hospital, we don't want to think about the mental health act. We just want you to get on with your life.
Yeah, me too. So.
And if that means changing doses for a temporary period, change doses for, you know
yeah, I'm up for that. I don't mind doing any of that. So that's cool.
Yeah.
Yeah, I could be taxi. I should probably walk.
Have you got a loan bus stop in?
I do, I can download. I'll just get a taxi. I've got to collect my meds from the from the doctor's practice, and then I've got to go to Princess Street as well. So I've left everything today. I should have done it this morning.
Do you want to lift the road?
If you wouldn't mind, that would be great.
Yeah,
man. Yeah, thank you. Well, I'll wait out there for a minute.
Yeah.
Right, okay, thanks guys. I'll shake your hands when I'm misfed. You know what I mean? Okay, thanks a lot guys.
Stephen, I won't, there's something to do about